Aorta.
The thoracic aorta, you really can't see on this model here, I don't think. But you can see it if you look at the heart model, for instance. We have ascending aorta, aortic arch, descending aorta, and as you come level with the root of the aorta and pass it, that little part is thoracic aorta down there. And you see it doesn't show up, it's all covered up on that torso model.
All right, intercostal arteries.
Intercostal arteries are not shown on anything we have. I have to show you a picture. It's the arteries between the ribs.
Okay, bronchial arteries.
That same thing.
All right, abdominal aorta.
Abdominal aorta is shown nicely on here. Okay, and you see where it exits the diaphragm, and that's where the name changes.
Okay. Celiac trunk.
Okay, celiac trunk is the first branch to come out of it.
All right, superior mesenteric
Superior
artery.
mesenteric artery is the next one.
Alrighty.
And then the inferior mesenteric artery should be right there. And someone really blew it because every model there ever was shows that. Like if you look at the one on the other side, you don't have to bring it over. Be positive, yeah, but it shows up on there very nicely if anyone ever wants to look at it.
Right.
I could say, what important artery is missing right there?
All right, right renal artery.
Right renal artery is that one.
Left renal artery.
It's over there.
Alrighty, left gonadal artery.
Okay, we have the gonadal arteries go to either the ovaries or the testes. And there's the left and there's the right.
Alrighty, then we have the right common iliac artery.
Right common iliac artery.
Left common iliac
Left
artery.
common iliac artery.
Internal iliac artery.
Okay, we have the right internal common iliac artery bifurcates into the internal iliac artery, which goes back in to feed the structures of the pelvic cavity, and the external iliac artery, which proceeds unbranched and exits through the inguinal canal right there. And there you can see it coming out.
Alrighty, the common femoral artery.
Common femoral artery is what we have. So am I getting in trouble back there? Sort of. Okay, I wanted to go back to my leg model here. So here we see the inguinal ligament, nicely demonstrated, and we see the external iliac artery as it passes through the inguinal canal, which is right there. And as it exits, the name changes to common femoral artery or common femoral artery.
Alrighty, so you did the inguinal canal, so let's do the superior vena cava.
Okay, the superior vena cava, let's see, is that little bit coming out of the top of the heart. Okay.
Alright, the brachiocephalic veins.
So we have some duplication, that's fine, yeah. So we have, and we even saw a nice, either a cadaver or an MRI of how the left brachiocephalic vein joins the right brachiocephalic vein over here. And this is the superior vena cava, right there.
Then we have the internal jugular vein.
Okay, this is the left internal jugular vein. The right isn't shown.
And then with the external jugular vein.
There's the right external jugular vein, and the left one isn't shown.
And we have the subclavian vein.
Okay, the two subclavian veins are there and there, left and right.
Alright, and then we have the azygos vein, the intercostal vein, the hemiazygos vein, and the azygos arch.
Yeah, only shown on pictures.
And then with the inferior vena cava.
Inferior vena cava.
We have the renal veins.
Okay, renal veins.
The right gonadal vein.
Okay, and the gonadal veins are kind of asymmetric. One of them comes into the inferior vena cava and the other one joins the renal vein. They don't both join the inferior vena cava, just because probably the one on the left would have to cross over the aorta to do that, so.
I stole your pen. Then the right and left common iliac veins.
Right and left common iliac veins are right there.
Alrighty, then the external and internal iliac
Okay,
vein.
the external iliac veins are there. And the internal iliac veins, I presume that one is shown a little better.
Alrighty, now we're gonna move on to the common hepatic artery.
Okay, so we go back over here. I brought my favorite model from home. So this is the celiac trunk, and the aorta runs right like that. Okay, and so you can see the celiac trunk just as it comes out of the aorta. This other model here shows it. There are things I like about this model a lot, and there are things I don't like about it. This really is more accurate in most regards, but they're both useful. And so there you can see the aorta and the celiac trunk as it trifurcates, except this one doesn't show the left gastric artery coming up. So anyway, go through and read those things, and
The common hepatic artery.
So, as we come out, we have celiac trunk, and it trifurcates, and this, remember, liver on the right, spleen on the left. So this little segment is common hepatic artery. Hepatic means liver.
Then we have the right gastric artery.
Okay, the right gastric artery isn't shown on mine, but it is shown on this one. It's just that little one right there. And the stomach is right in front here. Okay, and I was going to bring one over, but I couldn't find it at the last minute. And so it goes to the right side of the stomach. So this one shows the right gastric artery, but it doesn't show the left gastric artery. And this one is vice versa.
We have the gastroduodenal arteries.
Okay, so the common hepatic artery bifurcates into the gastroduodenal artery and the hepatic artery proper, which goes and feeds up here, and the liver sits right on top, just like that. Okay, and so the hepatic artery proper is that red one going in the bottom side of the liver. Okay, see that little red one that I got my finger on? So this is the hepatic portal vein running right alongside it is the hepatic artery proper, going in the bottom of the liver.
Alrighty, the left gastric artery.
Okay, so the left gastric artery, I'd have to use this model to show it, goes pretty much straight up, and the stomach is sitting over here. Okay, and it feeds the left side of the stomach, goes over here, like that.
The splenic artery.
And remember, spleen on the left, liver on the right. So the splenic artery goes over to the spleen.
Then we repeat the hepatic portal vein.
Okay, hepatic portal vein, turn this around, is shown nicely right there, going up into the bottom of the liver. And you can see it in purple underneath there. And the liver just sits right on top like that.
The splenic vein.
Okay, the splenic vein runs along the backside of the pancreas, as we said.
Inferior mesenteric.
Okay, the
vein.
inferior mesenteric vein is this one down here.
The hepatic veins.
The hepatic veins, so we have the hepatic portal vein, takes junky blood into the bottom of the liver, and it percolates up through the liver. Okay, and then you can just barely see them, are the hepatic veins, and so as the blood has percolated up through the liver, the good blood is dumped back into the inferior vena cava by the hepatic veins. So you need to distinguish between hepatic portal vein, goes in the bottom side, and hepatic vein comes out the top side. Okay, carrying good blood, which is then mixed in the general circulation.
And go to the leg.
Goes to the leg, okay?
All right, the obturator artery.
Obturator artery is that one right there. So these are branches off of the internal iliac artery, which is that one. Here's the common iliac artery, the internal iliac artery, the external iliac artery, and branching off, we're going to do 3 branches of the internal iliac artery, namely the obturator artery, the superior gluteal artery, and the inferior gluteal artery.
Alrighty, then the common femoral artery.
Okay, coming around the front side, we see the common femoral artery exiting through the inguinal canal.
The lateral circumflex artery.
Okay, going out to the side, we have, and if I took this one off, you could see it better. Probably should. Yes. So, right here we have the lateral circumflex artery, which feeds the hip and upper thigh, and we have the ascending branch of the lateral circumflex artery and the descending branch of the lateral circumflex artery. So if I point to this one, what do you write? You write descending branch of the lateral circumflex artery. Okay? You think I'll do that?
Mm-hmm.
Probably will. If you're going to take the time to learn it, I'll probably ask it. So you'll either next week or on the final, you can bet on it.
All right, then the common femoral artery bifurcates in the profunda femoris artery.
Okay, so here is this deep one, the deepest artery of the thigh is the profunda femoris, which is Latin for deep femoral. Okay, so there's the profunda femoris artery, and this is the superficial femoral artery.
Nice. Then we have the adductor hiatus.
Okay, so the superficial femoral artery passes down here and passes through this hole in the adductor muscle called the adductor hiatus and exits posteriorly to become the popliteal artery.
All right, and then the lateral superior genicular, I think I can't see it.
Okay,
Artery.
so lateral superior genicular artery, and so this is the lateral side, and that's the superior one, so it's that one. There are 4 of them.
All right, and then the medial,
And the medial
Genicular artery.
superior genicular artery's got to be that one.
and the lateral inferior genicular
Lateral
artery,
inferior
and the medial
and the
inferior.
medial inferior.
We have the posterior tibial artery.
And posterior tibial artery is what we have left. It
The-
gives rise to the anterior tibial artery, which passes deep and comes out the front.
Then we have the tibio-peroneal trunk.
The tibio-peroneal trunk is this little section between my fingers. Between the anterior tibial artery and the peroneal artery.
The peroneal artery is next. Okay, then the popliteal vein.
Popliteal vein is the blue one in back there.
Femoral vein.
Okay, femoral vein is this one up here.
Greater saphenous vein.
Greater saphenous vein, remember, is a superficial vein, so there's no way we can show it in a model of this type, but it's going to come down the most medial superficial aspect of the leg all the way down. It's the longest vein in the body.
Now we move on to the cerebrovascular circulation.
Cerebrovascular circulation. So,
Good. We're gonna start with the vertebral arteries.
okay. So here we have the cervical vertebrae, and you see the vertebral arteries passing up bilaterally there. There's a little bit of slack on either side, so that you can turn your head without ripping the artery in half, which is convenient. That's why you see this sort of, it's even more than this. There's a little loop of slack there, so you can turn your head.
The basilar artery.
Okay, so those two vertebral arteries confluence to form the basilar artery, which runs up the anterior aspect of the brainstem, and it bifurcates into the two posterior cerebral arteries, which are those two.
And then we have the superior cerebellar artery.
I'd have to show you that on a picture, because that's the one right below, and that's just too hokey to
Okay, then we have
do
the
off a model.
posterior communicating arteries.
So, posterior communicating arteries would come off right about there on either side and connect to the anterior circulation, but we don't, they're so small, and I don't have anything that shows them. But looking at the bottom side of the brain here, are we gonna do internal carotid artery pretty
It's
quick?
next.
Next, that's what I thought.
Internal carotid.
So you see a nice view of the internal carotid artery right here. And the internal carotid artery bifurcates.
To the middle cerebral artery.
Yep. So you can see a nice rendering of the middle cerebral artery right here.
And the anterior cerebral
And
artery.
the anterior cerebral artery runs bilaterally inside the longitudinal fissure. Okay? And so if you looked at the other half of the brain, you'd see another internal carotid artery and another anterior carotid artery running right along there. And connecting them would be a little anterior communicating artery right there.
That's next.
Yeah.
Anterior communicating artery.
Yeah.
All right, we're gonna go into the venous drainage. So the
Venous drainage, good.
the superior sagittal sinus.
Okay, superior sagittal sinus is right there.
We have the transverse sinuses.
The transverse sinuses come out, or can't be shown on a sagittal model because they come out like that and go back in the other way.
Okay, the confluence of sinuses.
This is the confluence of sinuses.
Okay, the sigmoid sinuses.
Okay, the sigmoid sinuses, remember the transverse sinuses drop down, do an S-shaped thing, and become the internal jugular veins.
Will you ask most of those on pictures?
Remember I had a transverse
Yeah.
sinus and a sigmoid sinus, yeah,
Okay.
I'd have to.
Yeah.
All right,
Yeah.
and then the jugular foramina.
Okay, the jugular foramina of the cranium. Gee, I wasn't prepared for that, but we'll have to, you wanna grab me a skull? I'll show it to you.
Okay.
Anyone?
And when you ask, if that's on the quiz, would you ask it as jugular foramina of the cranium?
No.
Just the jugular
Jugular
foramina.
foramina, yeah. So that's fine, yeah. Thanks. Yeah, Atlas held up the world. Okay. So, it's this big, remember that veins, this jugular vein is kind of halfway collapsed at any one time, and it comes through this sort of oblong. See that little jaggedy little hole in there? Okay. Maybe if I took the top off and poked my little pokey out the bottom.
In the purple at the temporal section.
What?
Is it on the purple side? Is that where it was?
Yeah, you see this
Temporal. Orange.
oblong hole there?
Mhm.
Okay, on both sides. Strangest looking hole in the cranium without a doubt, because it's real long and irregular.
And then we have the internal jugular veins.
Okay, internal jugular vein is right there.
And that's it.
Okay, piece of cake.
Yeah, you're fine.
I was like, I sound the worst spot for someone that's